Hi, and great to be back here at DiabetesMine, and thank you so much for inviting us, Amy. I'm already looking forward, to be honest, for the next in-person meeting, but I guess, that's what we need to live with now virtually. So, my name is Frank. I'm the co-founder and co-CEO of 9am.Health. And, I'm living for now over 20 years with type 1 diabetes, and I personally kind of know how cumbersome it can be to manage a chronic condition, and I'm sure we can do better. So that's, when we started with 9am.Health, we were really thinking, how would actually healthcare look like if it would be invented today? And we started to rethink it from the ground up. So, and that's why, 9am.Health will really disrupt how healthcare, or more specific, chronic care, is delivered. But first of all, let me give you some background, maybe about me and my co-founding team. So basically, kind of myself, just as my co-founders, we all worked at a company some of you might know, is called My Sugar, and we built My Sugar to one of the most kind of popular diabetes management platforms, and now My Sugar has around 4 million users on the platform. We're still, of course, very proud of it. But I always think that of course, we were working 10 years on My Sugar, and when we started, we basically started with Digital Health 1.0. So you manually punch data into the My Sugar app, and the app did something with it. And then, we developed into Digital Health 2.0, where kind of data was aggregated from connected devices, blood glucose meters, CGM, insulin pumps. But we also felt like, that was how far we could go. And now with kind of what we want to do as 9am.Health, we really want to create something, more comprehensive, probably kind of Digital Health 3.0, where we really kind of treat every important aspect of the whole care continuum. Because, when you think about, how healthcare is delivered today, it basically didn't change in the last 50 to 60 years. So you still kind of call your doctor, you need to wait for an appointment, often you need to wait not only days but weeks, and depending on where you live, you actually also need to do a longer kind of commute to your doctor. So then you wait in the waiting room, and the doctor then has a few minutes with you. So that's reality. And then you get a prescription, pick up prescription. And overall, it's a pretty long process, super cumbersome, and just a lot of wasted time and energy, of course. Overall, not a great experience. But why? It doesn't have to be that way. Why can't healthcare and the healthcare system just treat us as a consumer, and provide us a good experience? That's where we come into play. We make the whole healthcare process digital and very easily accessible from your home, your couch, wherever you are, on your schedule, when you have time to see us, not the other way around. We just make it easy, affordable, and kind. Let me explain to you how we do that. So, we put all the important aspects of care into one curated experience. And with that, I mean the doctor visit, your pharmacy experience, and the continuous care that you as a patient living with a chronic disease, deserve. And that's how we do it. So first, the consultation with our doctor actually happened in a smart chat-like interaction or consultation. And as a first step, we currently onboard patients who live with prediabetes or are already diagnosed with type 2 diabetes. And once you completed that consultation, your answers are reviewed by our provider group, and we develop a personalized individual treatment plan for you, and that is accessible through our web app. And our providers, they prescribe you the most appropriate medication, Beyond prediabetes and type 2 diabetes, we also cover the most common comorbidities, mainly hypertension and hyperlipidemia. And once we figure out, which meds you need, we trigger a shipment of your medication, and they will land on your doorstep in the next 2 to 3 days. So, but we all know that just meds is not enough, and that's why you can also do the next steps with us. So through 9am.Health, you can also get the most important labs that you need. So like an A1C check or a lipid panel. You can very easily do these tests at home. You send it to our lab. You get the results. Our doctors review the results, and based on your results, our providers will adapt your medication dosages. And the great thing is that you will always have access to a wonderful care team, that consists of diabetes educators, nutritional specialists, and pharmacists. They will be there for you and answer any question you might have around your diabetes care. So now let's do business. We are a direct-to-consumer cash pay company. Currently, we do not accept insurance, and we don't plan to at the moment. Our goal is to really tear down the access barriers. And with access barriers, that access to traditional healthcare can be challenging. So be it because your doctor lives further away, or you simply can't, take time off at work to see your doctor. These are almost kind of physical access barriers. And, but there's also like another important access barrier, which is you can't afford care. And we specifically want to help people who are uninsured or underinsured, and to provide them access to great diabetes care for a very, very affordable price. Our goal is always to stay below your typical copays. Because fact is, our plans start at $25 per month. You get access to our care team. It includes a drug, and you pay $5 per additional drug you might use. We only charge $15 per month for lab tests, and we got you covered. So, and we think that actually by lowering the medication costs, because we use generic drugs, and by making the doctor visits virtual, we are highly, highly effective and efficient, and we rather invest more into the ongoing care aspect, because we're sure that we can deliver better outcomes through that mix. In case you ask yourself, why the hell did these guys call themselves 9am.Health? I think a lot of us in that room here, in this virtual room, live with a chronic condition, live with diabetes, and we all know that, not every day can be perfect. But the good thing is, tomorrow's a new day, a new chance to make things better. And for me, and probably most of us, the real day starts at 9 a.m. So that's, when the kids are in school, your morning routines are done. And basically the challenges of the day are waiting after 9 a.m. And that's why we call our company 9am.Health. I hope you enjoyed the presentation. I'm super excited to hear your questions now. Thank you.